Welcome to our guide on your health plans for Smart Local 33. Let's break down the details you need to know to make the most of your coverage in the Youngstown District Health Benefit Plan. To become eligible for Youngstown District Healthcare coverage, you need to accumulate enough employer contributions in your dollar bank to cover the cost of coverage. Coverage for the Youngstown District Healthcare has a 6-month delay, so work done in January would be for July's eligibility for coverage. You will be initially eligible for coverage the first day of the month, following the day that you have accumulated 3 months of the current monthly premium cost. You will then automatically have insurance until you get caught up to the 6-month lag. The amount of hours needed to get to the premium each month depends on the hourly contribution rate that is on your classification's wage sheet. Here's an example. A BT member contributes $9.58 per hour to health and welfare. The current monthly premium has been set at $1,293.30 per month. A BT member would have to work 135 hours in a month to hit the premium cost. The Youngstown District Healthcare has the same plan for all classifications of workers, single and family. While the plan includes prescription coverage, the deductible and maximum out-of-pocket costs differ between single and family plans. The enrollment package comes with the summary plan description for the Youngstown District Plan that will explain coverage for in-network and out-of-network, co-pays, deductibles, and plan out-of-pocket limits. An enrollment package will arrive once you accumulate enough employer contributions to become eligible for coverage as a new member. The benefits enrollment package will include a welcome letter, a summary plan description, a vital information form, a dependent coverage letter, a summary of benefit coverage, a summary of material modifications, a COBRA rights form, an other insurance inquiry, privacy disclosure forms, a member website participant letter, an MSA reimbursement form, and a HIPAA disclosure authorization form. Make sure to complete and return along with any other required information, including marriage and birth certificates of dependents. It is important for new participants to keep track of their hours leading up to initial eligibility so that they know when they are eligible. They will be eligible before they receive their card. A member could be eligible for 2 to 3 months before receiving a card. If you or a dependent need to use the insurance before you receive your card, you can call Benesis for a temporary ID number. The dollar bank is the money paid on your behalf by the contractor for hours worked. That is in excess of your eligibility cost for the plan you selected. Let's break it down. In this example, you work 135 hours to maintain eligibility under the basic family plan. If you happen to work 160 hours, that 15 hours that went over would go into your dollar bank. Any money accumulated after those 135 hours goes into the dollar bank. This money gets multiplied by the hourly contribution rate shown on the current wage sheet. Let's discuss the Medical Savings Account, or MSA. If your classification is set up for contributions to a MSA, those contributions received will be accumulated in a separate dollar bank. The member will be issued a BeneCard that can be used for MSA expenditures. There is also a form that can be filled out for reimbursement of paid medical-related bills. This is used to pay for any medical necessities that are not covered by our plan. These include co-pays, deductibles, medical bills, prescriptions, and self-pays. For dental, the insurance is an optional buy-in once per year. If you miss it, you'll need to wait until the next year. The cost of dental is added to the monthly premium cost, and uncovered dental expenses can be paid with the BeneCard. Optical is not included in the plan or as an optional buy-in, but optical expenses can also be paid with the BeneCard. Don't forget to save all itemized receipts showing that the expense was for you or a dependent. You'll need to submit them to the plan via mail, email, or even drop them off at the Youngstown District Benefit Fund office. And remember that this is not a requirement of our administrator, but a requirement by the IRS. And if the itemized receipts that are needed are not turned in, the individual's BeneCard will be turned off until receipts are submitted or forever if not received. Thanks for watching. If you have any questions, please contact the Youngstown District Benefit Funds office at 330-270-0453.